Welcome to this podcast-style webinar brought to you by the CCBHC State Technical Assistance Center, a partnership between the National Council for Mental Wellbeing and the Substance Abuse and Mental Health Services Administration. I'm Kristen Lupfer, Vice President of Housing and Income Supports at Policy Research Associates, working to support the STAC team. Today, I'm so pleased to host a conversation that gets to the heart of something every certified community behavioral health clinic knows firsthand. You cannot achieve lasting recovery without a stable place to sleep. Recovery housing, peer-supported, abstinence-based, or medication-friendly sober living environments has become one of the most promising models at the intersection of behavioral health and housing. And yet, for many CCBHCs and the people they serve, access to recovery housing remains uneven, underfunded, and hard to navigate. This conversation also comes at a moment of growing federal attention to this intersection. Through the Great American Recovery Initiative, SAMHSA has launched a pilot investment across 8 U.S. cities focused on addiction treatment, psychiatric care, crisis intervention, and recovery-oriented housing, a sign of how central these issues have become at the national level. Today's conversation focuses on Missouri because what's happening here is an innovative housing model really worth examining. We have a state behavioral health agency that is actively investing in recovery support services, a statewide coalition building the infrastructure and quality standards for recovery housing, and a 23-year-old recovery housing organization in Kansas City that is on the front lines of what this work looks like every day. In the next hour, we'll hear from 3 guests: Rosie Anderson Harper, Director of Recovery Services at the Missouri Department of Mental Health; Brendan Steenbergen, Executive Director of the Missouri Coalition of Recovery Support Providers; and Bobby Jo Reed, Executive Director of Healing House in Kansas City, one of Missouri's most established and comprehensive recovery housing programs. And together, they represent the state, the statewide provider community, and the direct service level. This webinar is recorded and will be available on the CCBHC Success Center website, and we'll also share a list of resources mentioned today in the follow-up email. So let's get started. I'll turn it over to our guests to introduce themselves, and we'll start with Rosie.
Okay, good afternoon. As mentioned, I'm Rosie Anderson Harper. I'm the Director of Recovery Services for the Missouri Department of Mental Health Division of Behavioral Health, and I lead Missouri's Recovery Support Services portfolio at the state level, overseeing the Department of Mental Health contracts with recovery support providers and substance use treatment organizations statewide. In this role, I shape policies, funding streams, and quality standards that govern how recovery housing and recovery support services are delivered across Missouri. The Division of Behavioral Health contracts with recovery support providers to deliver services including care coordination, recovery coaching, recovery housing, transportation, and this is offered in the community by community organizations, faith-based organizations, peer recovery settings throughout the state. The department works closely with the Missouri Coalition of Recovery Support Providers and the Recovery Support Service Providers to enhance the quality and the capacity of recovery services throughout the state. And one of our current priorities is ongoing funding for these services.
Thank you. All right, Brendan, you next.
Hi, yeah, thank you for having me. I'm Brendan Steenbergen. I'm the Executive Director of the Missouri Coalition of Recovery Support Providers. We go by MoCrisp since we're quite a mouthful of an organization, but we are a statewide coalition of different recovery support providers from rural areas to urban areas across Missouri. And we do a number of functions. One, we serve as a unified voice for the state recovery support providers. We serve as an advocacy outlet for state and federal and local government outreach. We try to assist our partner agencies with training opportunities, grant opportunities, and just any sort of support network that is needed, and make sure that these organizations, some of them are very established, like Bobby Joe's, and some are just up and coming, have the same access to resources and have a network of people that they can reach out to and work with, so that as they try to do this good work across the state, they're supported both within the industry, within their fellow providers, as well as at the state and federal and local levels, so that we join forces as an organization so that we're stronger together than apart.
That's right. You want me to go?
Yes, please.
Hey, hi, everybody. My name's Bobby Joe Reed, and I am a person in long-term recovery. I have 31 years in September, and Healing House really came to fruition because in Kansas City, I figured out I was carrying the message when I got sober, and I figured out there were 900 women going through inpatient treatment in our city every year, and there were less than 30 beds for the women to go to. And most of those were earmarked for women and children. So what Healing House has done, we have seen the need. As the need comes, we adjust. We want to address the need. We want to, I don't just move the barriers over, we kick them down, right? And so we make a way to serve the people that have needs. So we've been going about 23 years. We help around 1,100 people annually. We currently provide homes for 225 adults every day and around 30 kiddos. We have 6 new babies in the last 2 months, babies that were born drug-free, and in an environment of health and wellness and love and support. And so we have women's homes, men's homes. We have apartments for our families. We also have a pregnant women's home and a new mother's home, and expanding all the time. So, just whatever the need is, we like to move forward and make it happen.
All right, fantastic. Thank you all. 3 vantage points here: the state, the statewide coalition, and a program doing this work every day. That's exactly the range we were hoping for. So let's dig in and start with the big picture. So Rosie, can you describe what Missouri's recovery housing landscape looks like right now? And then Brendan and Bobby Joe, jump in to say, what does that landscape look like from where you sit?
Okay, at the department level, we contract with approximately 70 recovery support providers to deliver services statewide. And for us, recovery support includes care coordination, recovery coaching, spiritual counseling, group support, recovery housing, and transportation to individuals for their unique pathways to recovery. And so these services can be before an individual goes to treatment, while they're in treatment, or after they've completed treatment. So it's a full array of, they can come into recovery support services at any time. And then it's offered, like I said, in the community with faith-based and peer recovery organizations. We also contract with the Missouri Coalition of Recovery Support Providers. They're our affiliate with the National Alliance for Recovery Residences. So as of May, we had over 4,091 accredited recovery housing beds in 303 active recovery houses statewide, which I think is excellent for a state our size. I also want to mention some specialty programs that we have. We have 12 recovery community centers around the state. These are actual physical locations that anybody can walk into and get peer support, get a hot meal or a sandwich or a cup of coffee, and talk to someone about what their needs are today. We also have 5 peer respite crisis stabilization programs. We have 4 mental health peer-run drop-in centers and a peer-run phone support line or warm line. And so that is kind of the overview. I also just want to mention we have 25 certified community behavioral health centers. So we are a statewide CCBHC state, and we were one of the early adopters of that model.
Yeah, and I will say, Rosie pointed out some of the growth that we've shown. We reached 4,000 active beds this year, which is a great landmark for us because, on our board, we have a number of folks who've been there since the very beginning of MoCrisp. And, I've told the history of our 20 years as a burgeoning unified organization that when we looked around and we said if we could get 100 accredited beds, we would have really done something in the state of Missouri. And now we've exceeded 4,000. So the growth has been dramatic and it's been exciting. Over 300 active accredited facilities. One thing I didn't mention in the intro was that, as Rosie said, we serve as the state's accrediting body. We are the NAR, the National Alliance of Recovery Residents affiliate for the state of Missouri. And so we have a housing inspector who goes around and performs those inspections and reaccreditations and investigates any grievances and make sure that everybody's meeting the standards. And it's a very large part of what we do as well, besides the support network that we provide for our providers. So we've seen a tremendous amount of growth. We've seen a lot of buy-in from organizations. There's various reasons why new recovery housing operations might have skepticism about joining an organization. We are primarily faith-based. So involvement between faith-based organizations and governmental entities, there's always some maybe apprehension that, well, will we be able to practice our beliefs without, having to fit within a certain mold or a certain model to meet government standards. And we make sure that we are a bridge between the government and then these nonprofits that have various, different missions, a lot of them faith-based, so that they can feel comfortable and know that they've got a partner and an ally and not an obstacle in their mission. And so the growth we've seen and the buy-in that we've seen, I think has been tremendous. Even within the last couple of years, we've seen an uptick in that.
Okay. So I started with one home. I thought I was going to help 10 women in their recovery journey. And we lived in a really crime-riddled area. So the dope man moved in right next door after I started the first house. So we had to get rid of him. So that became our second recovery home. So we have went from one recovery home. Actually, we're working on our 18th recovery home right now. The need is so great. So what we've really done is not just changing individual lives, but we have changed the landscape of our community. It was crime riddled and it was awful here. And so throughout the years, taking these abandoned homes in our community and fixing them up ourselves and making them into beautiful homes to serve the people, has really transformed everything. Now, I can say that we usually have about an 8-week waiting list. The need is great. And so unfortunately, the need's probably not ever going to go away because addiction has been with us for a very long time. And so I've been in this since the beginning, since the coalition started. And I have seen the changes throughout the years. I am so grateful that we've been able to increase the housing. My concern is always that we maintain quality housing and that we're the best of the best providing these services, and that our people that come through our doors, safety, love, and safety. When you've been out there in your addiction, you have not felt safe for a very long time. So to provide a safe housing community for people to heal from all the trauma and all the things they've experienced is key. And I take so much pride in knowing that I provide that to everybody that enters through my doors every single day. And we are stronger as a state, and we do have qualifications that people must meet. And we're doing the deal here in Missouri. So woohoo! But it is good, and we have lots of passionate people that provide these services. And I am honored and proud to be part of MoCrisp and Department of Mental Health.
All right, fantastic. It sounds like there's so much excellent work going on and growth. You have the infrastructure, so many homes, providers, this coalition, but the demand really is outpacing that supply. That 8-week waiting list says it really plainly. Let's talk a little bit about the state's role in shaping that infrastructure, not just funding it, but really this setting those standards, the expectations that government. So, Rosie, can you speak a little bit about the role that the Missouri Department of Mental Health currently plays in overseeing and regulating recovery housing? I know, Brendan, you mentioned some of this a little bit, but also how MOCRISP and NAR accreditation systems work alongside that state oversight, and speak a little bit to that structure.
Sure. So recovery support programs must be certified by the Department of Mental Health. We give the reciprocal certification for the Missouri Coalition of Recovery Support Providers, National Alliance for Recovery Residences accreditation. So if they say they're good to go, we will give them a reciprocal for that piece of it. But for the other services, they have to go through our certification process. So we have policies and procedures and code of state regulations that they have to follow. We have surveyors that do certification visits. So we know that they meet that minimum standard of care.
Yeah, and being the affiliate for NAR, they have different domains that they focus on whenever we're doing our inspection process, and those are like their operational, environmental. We want to make sure that this is a safe environment, as Rosie mentioned. We want to make sure that we have support systems in place. We want to make sure that we're good neighbors because there is a stigma attached to addiction and recovery, and so if we can show that we're good neighbors and that our places are kept up to a high level of curb appeal as well as just behavioral, you know when people walk by a place, they don't want it to look out of place in a neighborhood, right? And then make sure that there's proper property management, and then that the operational policies adhere to perfect standards of care and adhere to a social model of recovery, which we follow. And NAR has different levels that they certify at 1 through 4, and that ranges from the level 1, which is completely peer driven, closer to the Oxford model, all the way to level 4, which is full wraparound services, recovery housing, and clinical care integrated into the housing. So most of Missouri, I would say, is at the level 2, where they have a paid supervisor or house manager, and then there's a senior resident that manages the facilities. And then we also have level 3, where we have fully paid staff, and then there is structured wraparound services, which I think are essential to making sure that the recovery process is lifelong for everyone. And so the 2 and 3 is where we are sort of hit the Missouri basis. And so anyway, we focus on that, and then our partnership with both the state and local governments are essential because there is the issue, like I said, that NIMBYism. Whenever we try to open a house in a neighborhood or a community that has not had a recovery housing facility before, oftentimes there's a little bit of pushback that they don't want what they perceive as bringing people who are on drugs or addicts into a neighborhood. But what we often tell them is that the addicts are already there, right? And now what we're doing is bringing a safe facility that will take folks who are already struggling in their communities and bring them back to their families, back to the workforce, back into the schools. Start paying taxes into your community, start paying child support back to the kids in your community. And what people will find often is that we're great neighbors. And I think Bobby Joe can incredibly speak to that with the work they've done in Kansas City.
Yes, I can. So I wanted to say, back to the question, when we first started partnering with Department of Mental Health, it was like, oh my gosh, what have we done to ourselves? There's so much paperwork. I wanted to pull my hair out. This is not, I just want to be honest, it's not always an easy transition. And so thank God that we had people like Rosie and Mark Shields and Jesse and Val and Nora that were patient with us. We were patient with each other because honestly, people didn't understand the importance of recovery. People just thought treatment was recovery. That was, people would go to treatment and then they'd get better. And that's just not how this works. I mean, people what we provide is we teach people how to live. Treatment teaches people about their disease, and we teach people how to live. And so we're all part of the same pie, and we're all, each ingredient is just essential to the other. And so there's still that barrier, and we're working hard to break that down. I believe that throughout the years and us working together, I love our relationship now, and it is good. And we've got all the crinkles out, or most of them. We work together as a team, honestly. And Mo Chris, we got our accreditation or our acknowledgement like 15, 16 years ago. But to be honest with you, we have been working at this for over 2 decades, working together, building a coalition. We were one of the first faith-based coalitions in the country and leaders amongst that. So our coalition has really existed for over a couple decades. We've been doing this work. Now we have a name. We've had a name for a few years, but the work has always continued. And more and more people have came on board so we could continue to accommodate the people we serve. And so it has grown immensely. And we need more growth. Actually, we need more people on board, quality people that have the passion to do the work.
Yeah, just so foundationally, we did start in the early 2000s as an access to recovery state. So those grants were coming from SAMHSA, and that kind of got us started on this recovery provider journey. But that was the foundation, is the funding that we got. And then we were able to get state funding that was able to then continue once our access to recovery grants ended.
Yes.
Yeah. Well, that's a perfect transition actually to the next kind of topic and question I wanted to explore with you all, which is really about the funding streams. And we want to explore like what resources are out there, because we know that, demand is outpacing supply right now. So because funding is this kind of core challenge, Rosie, what are the like existing funding streams that Missouri's been able to deploy for recovery housing? What's worked and what hasn't? And then Brendan and Bobby Joe, what's your view from the provider side? How's that looking?
Yes, so we have multiple funding sources for recovery services, and I think that is wise to do that. We do use the SAMHSA block grant dollars. We use the state opioid response grant funds. We have state general revenue funds. We have had opioid settlement funds, and then what I call cannabis tax funds, just so that it's easy for people to understand. But we are a state that legalized marijuana use, and so there's a tax for that, and that goes through our Department of Health and Senior Services. We've also been able to access those funding. That is a funding source for recovery services. So again, multiple kinds of funding sources. And anytime, a new funding source. So now we've also looked at things like, well, what about rural health transformation, or all of these SAMHSA grants that are now coming out? So we continue to look for ways to fund recovery support services in Missouri.
Yeah, and to piggyback onto that, I think that diversity of funding is one of the biggest funding challenges for our providers, especially new or maybe less sophisticated programs that haven't been around very long. They rely very heavily on either state funding or federal funding, which is always we have to fight for annually, right? That can change at a year's notice depending on the national budget picture or change in an administration. So that has to be fought for to be retained. And, so making organizations aware of opportunities for private philanthropy or grants from private nonprofit groups or foundations, or just, entrepreneurial models to make sure that if any one funding stream ends, that you're able to continue to serve your community. That's always a challenge. And so that's something that we want to promote and make sure that our organizations are always cognizant of, to try to diversify that revenue stream. But on a more global picture within the state, Rosie's right. We were started during the George W. Bush administration's faith-based initiative, which created the Access to Recovery dollars. That went on for some time before it eventually sunsetted, and the state government saw the work that we were doing and saw the value in it and saw fit to take us up within their general revenue budget stream. And we have a line item there. And that was fortunately within the last couple of years, we've been able to expand that with the utilization of cannabis tax dollars. And we still do receive federal funding via SAMHSA, as Rosie mentioned, through SOAR funding and through the block grant. But there are other opportunities that we're always exploring. There possibly could be HUD dollars to take advantage of. There's the opioid settlement money has the potential to unlock a great number of new operations in counties that haven't had great funding in the past. It's a challenge to make sure that the county and the municipal levels understand what we do and how the money that they're receiving from the opioid settlement can be utilized, and how we can be a partner in that, because the work that we do aligns perfectly with the terms of those settlements. So it's one of the more important things that we do within MoCrisp, is to both partner with the state legislatures, the national government. Bobby Joe and I were in Washington, D.C. this week, talking to representatives from HHS, particularly within the Office of Faith, to talk about the work that we do and how we can partner with the administration to make sure that the work we do is supported. But so, because if we can't keep the lights on, we can't do our work. So it's a big issue for us, and it has obvious trickle down effects to the providers.
Yes. So we've had to diversify forever. So the recovery support service money, what they were talking about, that is a good funding stream, but it can vary from time to time. And, the only thing in a smaller agency and a bigger agency is you got more bills when you're a bigger agency. People say, oh, well, they've got all the money. No, I've got all the bills too to prove it. So we diversify in many ways. So we have private donors. We also have events, a golf tournament and a gala. We have grants that we are always looking for, because we don't have one funding stream that can really cover us or provide for it. So it has to be multiple funding streams coming in at all the time. And we have to keep our eyes open all the time for any grants that could be open for us. This Great American Recovery Initiative is right in our wheelhouse. I mean, it's what we do. It's almost written directly for us, I feel. And so we're going for that in one way or another. But I mean, it is actually what we've been doing for 20 years. And so I'm very excited about that. And I'm excited that the administration, that we're finally really getting some acknowledgement of the work we do. Because it's life-changing and life-saving, and it needs to be cohesive. Every part of this working together, because it's not a single source that's really going to bring a new life to somebody. It's all of the pieces. People get here, they need IDs, they need Social Security cards, they need first off a safe bed, they need clothing, they need food, just the basic stuff. But then we have to go so much deeper than that. So we're always looking for ways to be able to put back into our programming and to be able to equip the people with all the life skills they need to make it, because the social component is very important too. If you don't learn how to have fun in recovery, if you don't learn how to balance work and life and all the things, then people get stressed out and they don't make it. So we all work together. And I love that these opportunities are coming to the forefront, so we can do what we do and what we love to do in a bigger more substantial way. I'm excited about it.
Yeah.
And Healing House has done an excellent job of helping to train other providers on this. So her chief financial officer has done training for some of our other recovery support services to teach them how to diversify their funding and not to expect all funding to come from the state. If you're only relying on state funding, you're not going to be able to make it. You have to diversify your funding. So we keep communicating that. And then folks like Healing House, provide that training, and MoCRISP on an ongoing basis to help the agencies understand that you're going to have multiple funding sources if you're going to want to stay in business.
Yep.
And that's a good point. And I'll say that like MoCRISP, our structure is set with 5 different regions. The state's carved up into 5 different regions, and each of the 5 regions has different coalition leaders. Bobby Joe and the Healing House, they serve as an access site for state funding distribution, and they are also a resource for training, because a lot of these organizations that are smaller, one of the areas where they suffer when it comes to accessing grants or private philanthropy is just lack of manpower and lack of know-how. So when they can lean on an organization that's established and sophisticated like Healing House, they can skip ahead. They don't have to learn these things from the ground up already, because they can lean on people who have done it and been through it and know how to do it. And they provide a tremendous resource. And that regional model has been wonderful for that, because it helps new organizations, as we've mentioned over and over again, the need when they get going. They have a lot of questions. They don't know how to do a lot of things. And when they can lean on those partners who have been established, it makes a big difference for them to find success without having to go through years and years of learning on their own and making the same mistakes over again.
And even when we weren't the access site, we always prided ourselves in going along with the smaller guys, because we used to be one of the smaller guys, right? And we know how tough it is. And so we have always prided ourselves in helping other organizations that are coming on board learn how to do these things, and so they could make it. I remember we had a recovery house that was not going to make it. They would not pass the inspection, right? And it was 2 little older ladies, and I loved them so much. And so I took my maintenance team over there before their inspection, and we fixed everything in their house for them, because we had the resources to do that. And they were good people and had good hearts, and I knew they'd take care of people. And so that's just something you do. We are a family here at Healing House, but we're also a family united as our state, all working together.
Yeah, absolutely. I can see that partnership so clearly. And you all took that, like the partnership building that you were doing around funding, and took it straight into kind of the partnership that it takes to really implement these programs. And so just want to encourage you to, keep expanding on this theme here about partnerships between the state, the coalition, the organizations, how that looks like in practice. Like you've already talked about what's going really well with that. Is there anything else that you wish that it could be, that you would wish for it in the future, in terms of the partnerships from all levels there?
I think one of the partnerships we want to make sure we highlight, and I'm going to turn this over to Bobby Joe, is the coordination between recovery support providers and the treatment providers, or the CCBHCs, right? So, for example, Bobby Joe works very closely with Swope Health Center, one of the large CCBHCs in Kansas City. And so there's a lot of coordination that has to go on there. And I think since that's many of who will be watching this, I'm hoping that Bobby Joe will talk about that coordination and how she works with the CCBHCs in her area.
Mm-hmm. Do you want me to go, Brendan? Okay. All right. So we partner with many agencies in our community. One example is Full Parkway, and we provide the housing. They while the folks are in treatment with them, we provide the housing. They come and pick them up and take them to treatment every day, and then bring them home. Here's the thing: and I know that the different mental health centers could go into the housing, but why go into the housing field when you have experts that already do it? And it's really good for the people we're serving, because it's not just a continuation of what they're doing every day, right? So they live with us. And so on the weekends, we're having pool parties, we're having barbecues, we're going to museums, we're going to the zoo. We've got a choir coming in, we got a band every Friday night. So there's a lot of the social aspects that the treatment component can't really address because there's limitations there, and we're teaching people how to have fun and how to just manage life. And so we've had a long going partnership with Soul Park. We partner with all the local agencies, so Truman Hospital, Rediscover. And that's what it is. We can't have barriers up between us. It's about the partnerships, and nobody needs to reinvent the wheel. Everything's in place already. Let's use the resources that we have available to us. And here's what I would encourage: the centers need to come out and see what we do. Come to my house. I want you to come check it out. I want you to come see where your folks would be staying. I want you to meet my staff. So, for example, I have 56 employees. 48 of the 56 are people that have came through here as a participant. 48 of the 56 came through our program. I call them all my kids. They're all my kids. I'm mom to everybody. 4 of my kids became first-time homeowners this year in my community. So you know what? The people that are being raised up here, we are walking alongside them, and we want them to be successful in life, right? It's not just why you're here with us. And so, we have, like, I'll give you a great example. We got 4th of July coming up. We put on a big 4th of July thing. We take up a whole street right next to the river. We had people that were here 20 years ago show up with their grandbabies for the fireworks and all the goodies and all the treats we have in pop. And we're on this big, huge street. Everybody's doing the bus stop together. We're playing music. Hundreds of people show up there. And some of them I haven't seen since last 4th of July, but they bring their grandchildren. This is a lifestyle we're creating. And the Bible talks about we all have members of our body, right? And an eye can't do what a hand can do, and vice versa. And so it takes all of us working together to really make somebody whole. And I've been preaching for years, no division amongst us. We all work together for the greater good of the people we serve.
And we've talked a lot about the things we're doing and the things that have gone well, and it's kind of a love fest. I'm not going to pretend like there haven't been or there won't be problems or that there aren't problems. There's always need for more money. There's always communication gaps. There's always differences of opinions and turf, battles and things like that. But the reality is, what I would like to see with like our partnership with the state government, I feel like we're moving in that direction already. An example I would say is that we're changing how the state funding is going to be distributed, and so that's happening at the Department of Mental Health. But MoCrisp and our providers have been involved at every step of the way since that change has been announced, and we're a part of the solution. We're in each meeting, and so that coordination and that communication is there. And there's anytime there's a change, there's trepidation. But the reality is that if we all work together, if we remain transparent and we involve as many people as possible, the possible stumbling blocks are reduced. And then when we talk about the combination of working with treatment and the recovery providers, I think that's growing and building as well. I think one of the things I would say with treatment in areas that are introducing housing into their clinical model is that it's important to, like Bobby Joe says, involve yourself and see what we do, because recovery is about a lot more than just housing. the wraparound support services that we provide and the building of community and the building of relationships is really what makes recovery work. And in Bobby Joe's organization, I mean, she has built a community like none other. It's written on her body and on her arm. She has a tattoo that says "Welcome home, baby," and that's it. I mean, she wants everybody to come see Healing
Yeah.
House, whether you're a
Yeah.
government agency or whether you're a treatment provider or whether you're a potential client, everybody should come to Healing House, right? Because it is the community that builds recovery. And, isolation fuels addiction and community destroys addiction. So, that relationship we have with our treatment providers is works best whenever we are working together because we can't be successful without the work that they provide, and I don't think that they can be successful without the work that we provide. And our collaboration with the Department of Mental Health, and Rosie in particular, I think I should point out that she's been a partner for this for so long. She's an incredible knowledge base and resource, but also friend to the people who are in this
Yes.
field in the state of Missouri. And very few people in this business would, if you brought up her name, wouldn't know who she is and wouldn't have positive things to say about her.
And I
Yeah.
would
I
say
always
to
felt
thank
you're
you.
to me, Rosie is not an overseer. She's a co-worker in this. And I've always felt that, not somebody I got to be scared to talk to, but somebody I'm anxious to talk to and get suggestions. And, that's been a long-term growing relationship that we've got to know one another. And Rosie has seen this whole part grow. And I do want to say it's not all roses. We need more dedicated funding for recovery because recovery is part of everything. And so I would love to see more funding dedicated to the recovery as a whole, right? And that is a lot of components. That's not just housing. We do tons of programming here, but not every agency is able to do that, right? We do parenting classes, we do GED classes, first time homeowner, budgeting, life skills. I mean, we do a lot of things and we get grants so we can provide all that stuff to the people we serve. But funding, let's face it, funding is always going to be an issue. And that's what people are going to fight over the very most because they don't want to let go of this because what do I do then? And so we just need to learn that every component of this has equal value. And that's been a barrier that I think I need to just bring up because I've seen it throughout the years and it needs to cease because it's all of us.
Right. And for any other state folks that are watching this, I would say, please treat it like it's a team and they should have your number. Like I make sure everybody's got my cell number, everybody's got my email. I am accessible. I come to all the, coalition meetings, the regional meetings, the conferences.
Yes.
Everybody knows how to contact me. I've already talked to Brendan several times this week. Bobby Joe reached out and she needed a letter of support, and I got her that. We need to be accessible to those that we're serving in order to provide guidance or to talk things through, to answer questions, those kinds of things. So I would hope all state staff would see it that way and be accessible to
Absolutely.
those that are providing services.
Absolutely. Excellent advice. You all have already been talking about kind of the fantastic ways that you've been able to partner, to promote and expand this work. But if you could each think of one thing, really concrete thing that in the last few years that you're really proud that Missouri and your role in that has been able to do to strengthen recovery housing. So one concrete thing you're like, this was a big win that we want to share.
We have been able to grow recovery housing. And so that is a big win. Also being able to create the peer respite crisis stabilization, which is again, a low barrier recovery housing. I just want to take a minute though, to talk about some of our outcomes. So we know that for recovery support services, so just those 4,000 people that we're providing that individual care to, 94% are housed at 6 months, 89% are abstinent, 69% employed, and 98% have no new arrests. And then for our recovery community centers, that the Harvard and the Recovery Research Institute has done research on this, and research has shown that from the time of addiction onset, it takes approximately 15 years for the average recovering US person to reach the same quality of life and functioning as someone in the general population. So 15 years from their addiction to recovery, right? But if someone is participating in recovery support services, they can reach that same level of quality of life as the general population in only 5 years. So when you put recovery services into this mix, we can reduce the amount of time it takes to get into recovery, long-term recovery. So I just want to throw those outcomes out there.
Yeah, that's great.
This works.
And it would be hard for me to just pick one thing, to be honest, because we did mention that we went over 4,000 active beds, and that was a big milestone for us, obviously. But there's other things that we've been successful in recently that I'm pretty proud of. And one is that in a very tough budget time, we have been able to expand the amount of recovery support service dollars that we've been able to get from the state through our advocacy work and through our relationship building with our elected officials. And that's been a real benefit to us, especially in a time where the budget picture nationally as well as at the state level has changed through the COVID epidemic. And there was a lot of money flowing through COVID that is drying up. It was not meant to last forever. And because we've been able to find support in other avenues, like with the cannabis tax dollars, that's been able to assure that our providers who may have been having revenue sources that are now drying up are able to continue the work that they're doing. And then finally, I would say that, a preliminary report recently came out showing that the number of deaths from opioid overdoses fell by data suggesting 20% year over year from 2024 to 2025. And it's the third straight year in Missouri that we've seen a reduction in opioid overdose deaths. And there is a national trend to where there's been a reduction in deaths from opioid overdoses, but Missouri has continued to outpace the national trend each of those 3 years. And I'm really proud of that. And I feel like the work that we're doing has played an essential role in that. And it's great when there's actual numbers that you can take to your legislators, but also go home at night and lay your head on your pillow and know that someone's alive because of the work you're doing.
Oh, Brendan, you stole all my thunder. I should have went before you. Of course, the reduction of death. That's what we're doing, right? But for me personally, or as an organization, I love that we're able to provide housing for pregnant women and have a place for new mamas, a home for them, and the opportunity for, just the children to be born in a safe environment. And, 6 births in 2 months. Those babies were not born in a drug house, and they were not born addicted, and they're healthy. And people, we have a family here. People fight over who gets to hold the babies, right? They have so many aunts and uncles. And I think, to me, it's always going to be about creating that environment where people can get healthy again. I tell people all the time, I have this great big dysfunctional family, but the cool thing about my family is we all know we're broken and we're all trying to get better together. And that's what we do. That's what recovery is about. And you know what? Another thing, we are the most resilient people you will ever meet. When COVID hit, we have all these houses like, how is this going to work, right? And so we got Zoom going, and I had pumpkin carving contest over Zoom at every house, right? And some of them were so creative, they carved their pumpkins and they shut out the lights and had them lit up and spooky music. We had gingerbread house making contests. We survived as a community, as a family. People were coming in and I'd have to shut down a whole house because somebody had COVID. And I'm like, this can't happen. So we had a space that we were going to put a gym in, and I made it into a triage center. So everybody coming in our program could go there and be monitored for a few days before they went into one of the big houses. We are resilient. And I think I want to say that as Chris. I want to say that as a person in long-term recovery. I want to say that as us all working together, we are resilient. It's one of our best qualities is that we don't give up because we so much believe in the work that we're doing that we're going to make a way out of no way. We're going to do it, and we always have. And I would say resilience is one of our best qualities, passion and resilience.
And I didn't steal Bobby Joe's thunder. Let me talk numbers, Bobby Joe, because nobody tells the stories better than she does, and nobody talks about relationships and community building and family better than she is. She was one of the first places I went whenever I took this position a couple of years ago as the executive director of Mocris was to the Healing House, and lunch was coming, and I couldn't find Bobby Joe, and I was like, "Where is she?" Well, we found her in the kitchen. She was serving up soup and making all this food, and I was like, "Is she doing this just to show for me?" And they're like, "No, we can't keep her out of the kitchen." And in fact, when Bobby Joe's cooking, you won't find salt and pepper on the tables because she'll tell you it's already seasoned perfectly. So you don't need to put anything.
Mama's got this.
Yeah. So she's there, boots on the ground, and she is in with everybody.
I probably get 100 hugs a day. And I love that's part of my life. I get to hug my kids every day, and they love it because they know they're special to me. I know their names, I know their faces, I know what's going on with them, and I care about them. And if somebody's sick, I remember in a couple of days, if I don't see them, how are you feeling, honey? They need to know that somebody sees them.
Absolutely. Bobby Joe, you described it as a dysfunctional family, but it sounds like a pretty functional family to me. It sounds fantastic.
Well, it's cool.
It's really clear that Missouri has built something really meaningful, and it took a lot of effort from the three of you and all of the communities behind you that are supporting that work. Want to get into where work still needs to happen, right? We've been touching on like the things that are going well, the things we still need, and I want to talk specifically about CCBHCs and how they're connecting people to recovery housing. And so I'm wondering what you all would identify as the systemic barriers between a CCBHC, the people it serves, having this kind of seamless access to recovery housing, and what could the state and the coalition and the providers do to help remove those barriers, help with those connections, make them smoother?
Yeah, there's always room for improvement, but I do want to say that, we do work closely with the Missouri Behavioral Health Council. That's our statewide association for all of our CCBHCs and substance use disorder treatment programs. Like I attend their meetings, I attend their housing meetings, their substance use disorder committee meetings. I'm at the table, they know who I am, they know what I do. And so we do have a place where we can talk about some of these things at the state level with that association. And I think that's important to know. Brendan is invited also to the substance use disorder committee meetings. They know who he is too. So again, anytime you can work it into the regular meetings that go on or the regular communication that goes on, I think that is important. And then also sometimes we have had to have one-on-one meetings because there has been a conflict. Like you may have a CCBHC that, here's an example. They have ASAM levels of care. They have an assessment, and this individual has to attend a certain number of hours to meet that ASAM level of care, right, of hours provided. But again, the housing provider provides some of those services too. So sometimes they got to get together and work it out, both, structurally with their memorandums of understanding, and also sometimes on that client level of, well, if you do this for Rosie, I can do this for Rosie, right? And then work out that level of detail sometimes. So it does take ongoing partnership, communication at both that macro level, what our expectations are, and also that micro level for sometimes each individual client. So now I'll pass it on to someone else, but those are my thoughts.
Okay.
Yeah. No, and it is a challenge because it's a complex animal. Right in this room, this virtual room, we've got a provider, we've got a government entity, and we've got the statewide organization. And then we're talking about the CCBHC, sorry, spitting things out. And they've got their own organizational structure, right? And so there sometimes are cross motivations. There's just lack of communication. But yeah, we work with Missouri Behavioral Health Council. their lead, Brent McGinty, he's got my number. I've got his, got an open door policy if we need to meet about anything. Several of the treatment providers will call me and work directly with me. But there are times whenever there's a lack of understanding about what one organization is doing with another and how, is there overlap or competition or things like that. And a lot of times it's just simply misunderstandings and they can be worked out with communication and with getting things together. But I do think that there is also people in the recovery business need to have a better understanding of what folks in the treatment side do, and people in the treatment side need to have a better understanding of what folks on the recovery side do. I already mentioned that recovery is more than housing, and there is a temptation to focus primarily or exclusively on housing because that is a focal point. It's a necessary first step, and that is where dollars have been allocated up. And so there's obvious motivations to put all the spotlight on that. But it can't just be a warehouse for people who are suffering from an addiction. We don't serve as a hotel, right? We try to get people to where they don't need recovery housing. They can live independently and they can rebuild that quality of life that Rosie's talking about that meets folks in the general public. And so we get to that 5-year mark instead of the 15-year mark. And without recovery support services, it doesn't happen. So, continuing the dialogue, continuing the communication, making sure that people are open-minded about the people who they're partnering with and not intimidated by someone else who's in their space, and realizing that we all have a role to play is, that I think it's an ongoing thing. It's the same as in any industry or any community where, where do you fit in and where does somebody else fit in, and how do we work together without stepping on each other's toes? That's just something it's built into the cake. So I think that the work we're doing I've only been at this for a few years, so I've been the beneficiary of the work people have been doing, like Bobby Joe, for decades, because we're on a path towards that. But we're never going to, it's one of those things we're working to put ourselves out of business, but we know that that'll probably never happen.
Yeah. And I would say we can partner, and what it is getting to know, like the other said, the communication between the health partner and the recovery housing. We determine what our roles are, right? What do you need from us? Okay, well, you need the people ready to be picked up at 8 a.m. So we're going to make sure everybody's up. They're ready to go. You pick them up at 8 a.m. They'll be back at 3:30 p.m. Like ours said, okay, we're not, one of our providers said, we're not going to do lunch for them anymore. Well, why is that? And how do we get around this? So, okay, so we're still partners. We're not going to let our people go hungry. So we'll send sack lunches with them. We don't want you taking our people to church. Okay, well, guess what? Everybody can go or have study time. There's always things we can do to work together. Here's the thing, nothing has to be set in stone. I know treatment has certain criteria and standards they need to live up to, but we found a really good balance. And it's kind of like what you might get by with at grandma's house, you might not get by with at mama's house. Does that make sense? And so here's our rules. This is how you're going to operate when you're here at the housing. But this is how you operate there. They're similar. They're really similar, but this might be more social activities. So we need to have a little bit more wiggle room here, right? Because we're trying to explore that part of life. And treatment, I understand they need to get so many hours and they need to go through their, I'm losing the word, assessments and what level they're at. But here we're doing life. And so that can mesh together very well. And it doesn't have to be a separation. And most organizations, we want to work seamlessly. And here's above everything else, we want people to recover. And so if we work together for the greater good of that person, what could go wrong? Oh, I do want to gripe about this real quick. So what I've been seeing, and I'm really in an uproar about it, is on the internet, these investors are saying you can do recovery housing and have 10 people in a house at $500 a person and make $5,000. That's insane to me. Have you guys seen those ads? Investors are trying to open up recovery houses. This is not a moneymaker. I want to say that. Never has been for me, because all the money that comes in, you pour back into what the people need. And so we got to be careful that this doesn't turn into a widespread people trying to make money, and it's really making money off the people that we're trying to serve. Because if, like you said, Brendan, if it's just a warehouse and just a place where people go sleep at night, that is not what we are. That's not what we represent. And so recovery is a bigger picture. And so yes, we can get more numbers of recovery houses, but we want to make sure that they are the right kind of recovery houses. Everything's not about quantity, it's about quality. And that's what Missouri is striving to do, is have quality housing for the people that are engaged in their treatment episode.
And I would say that's why I feel the accreditation process and the certification process is so
Necessary.
important, right? Because there are, like in any industry, bad actors, and
Oh,
people see it as an opportunity to make a profit. And the reality is, you're profiting on the most vulnerable people in the entire
that's right.
state. And so that's, I mean, that's evil in my mind. And
It
and
is.
so we want to make sure that people who are doing this are doing it for the right reason. There's certainly nothing wrong with making a profit and sustaining yourself and being a sustainable place that people can see you grow and succeed. But we are a nonprofit. That's not the primary purpose. There's nothing wrong with making money, but it's not why we're in this business.
That's right.
And if people are out to just like turn over real estate and see an easy dollar, I think one, they're going to be disappointed because it's a tough job. But two, they're not going to find success. And we do a pretty good job of research and tracking. And that's another essential part, because we can tell our legislators and we can tell the public what we're doing is working. And if there are folks out there that aren't doing it right, that's going to affect the data as well. And we'll be able to show what isn't working.
Right.
Yeah. Yeah, thank you both for sharing the concern and then kind of a solution to that. So we've covered a lot of ground, and I want to kind of close the session with a discussion about some maybe concrete action steps that our listeners can take away from listening to this incredible conversation. So if you could give CCBHCs in Missouri and the state officials who are supporting them a piece of actionable advice about advancing recovery housing, so in their state, what would it be?
Go visit your existing recovery housing providers. Go see what they do. Go learn. Go spend a day there, and see the amazing things that happen.
I would also say that we're in a changing landscape from a governmental standpoint, economic standpoint. There's a lot of new sources of money coming out. There's new programs, Bobby Joe, and as mentioned, the Great American Recovery Initiative. There's a new streets program that's coming out as a grant opportunity, but there's also the Rural Health Transformation Initiative that's coming through the country in Missouri, and a lot of new. There's a lot of new people coming to the table. And so when these new structures are put in place, I would say include someone in the world of recovery in those meetings. Make sure that recovery is at the table, because if you're really trying to get to the outcomes that are stated within the initiatives, within the press clippings, within the grant structure, if you want to really have success, you need someone who is in the world of recovery to be there within the decision-making process. So as those new structures and as those new groups are being put together, always be mindful that recovery is part of that picture.
Yes, and I would say that too. Go visit the people that you are considering to provide housing, show up, hang out, see what really happens there. I was thinking in the rural communities, if you don't have a place for people that are in need of help with their substance use disorder, you ought to look into the people in recovery that might be willing to open one of these houses to help the people. Because here's the thing, if nothing changes, right? And if my living circumstances, if I go back, even if I get a treatment episode and then I go back to my same circumstance, I'm not going to be able to maintain my recovery because I've walked right back in. So establishing that, just seeing what we do, how we operate. I mean, one thing is we got an open door policy. Anybody can show up at my house, any of the houses, any day. The beds are made because mama said so. Here's the thing. We're teaching people how to live. So guess what? You have a chore you're going to do every week. You make your bed every day. The house is orderly. People need, structure is important for folks early in their recovery and staying busy. And so we try to assist with that. And, for the actual treatment providers, you will rest easier in your life knowing that the people you're serving are safe with me or at these homes at night. And guess what? I know we all love data, but the outcomes are off the chart, to be quite honest. And we're not talking about, and you could say outcomes or numbers, but I'm seeing people, right? The people we serve, we're all going to be more successful, and the people we serve are going to be successful. And for a person, I was 22 years in my addiction. For me, be able to walk in freedom and not be caught in that bondage of addiction and wanting to die every day is a miracle. And ultimately, we get to live around miracles every single day, all of us. And sometimes if you're behind a desk or don't get daily interaction with people like I do, the work we're doing here is really saving lives. And I get to see it, and I hope you guys get to see it as much as you can. And if you don't see it, come hang out with me and you can see it here.
Perfect. I think that's the exact action step we all need, is we're going to come hang out. All right. I think I'm going to see if I can do a road trip to your 4th of July block party.
That'd be awesome.
All right.
It's so much fun.
All right. I want to thank you all for your honesty and specificity. I really do think this exchange has helped the people who are listening take something back to their work. So we are at time. I want to thank Rosie Anderson Harper, Brendan Steenbergen, and Bobby Jo Reed for a rich and honest conversation. What I keep coming back to is how much is possible when the state, the coalition, and the provider community are working from the same playbook, and how much harder it is when they're not. So Missouri is really offering this genuinely instructive example of what that alignment can look like. So for those of you listening, a few resources to look out for in the follow-up email from the National Council, the CCBHC Success Center website, which houses tools and training and state-specific implementation resources. We'll have the Missouri Coalition of Recovery Support Providers website and their directory and recovery housing impact report available to you. The Missouri DMH Recovery Support Services page, which has their SOR recovery housing directory and provider resources. We'll have the National Alliance for Recovery Residences standards, SAMHSA's best practices for recovery housing, more resources than you can read through in a couple of weeks of work, and then other information on upcoming learning sessions on housing integration with CCBHCs. Thank you so much for listening and for the work that you do every day to help people find their way home in every sense of the word. And thank you all.
Amen. Thank you.